Driving into Orlu town at this time is like entering a ghost town. Shops are under lock and key, markets shut down, streets are empty, and residents locked up in their homes. All some can do is peep through their corridors. Security operatives only seen on patrol and at checkpoints at intervals. Although the directives of the governor on the curfew says it's between 6 p.m. and 6 a.m. dusk to dawn. But for fear, residents of Orlu town are locked up in their different homes, taking these directives very seriously. The only people you see on the streets of Orlu town right now are security operatives trying to maintain law and order. This is the popular Banana Junction. It used to be a beehive of activities, but due to what happened yesterday, it's been deserted and economic activities crippled. This is what is left of some of the properties destroyed, while bloodstains can still be seen outside some shops. Residents say they still live in palpable fear following the violence in some parts of the town on Monday. Some residents who spoke to Channels Television on the incident say all they want is peace, normalcy and return of economic activities.
We want movement this particular point in time, but we want peace. Then how can we restore that peace? It's only people in Orlu that will restore the peace.
Meanwhile, an umbrella socio-cultural group for Orlu people known as Orlu Cultural Union has expressed concern over the ugly incident. While suing for peace, they call on the state government to, as a matter of urgency, ensure immediate evacuation of military and paramilitary men from Orlu.
Let us, in the interest of peace and mutual coexistence, eschew sentiments, bias and negative primordial interests, come together to resolve the issues, stop the killing, and ensure that peace and normalcy.
Although the dusk to dawn curfew is still in place and security operatives on the ground to forestall further breakdown of law and order for Orlu residents, all they want is an end to the crisis and freedom to carry out their daily activities. Iyitopakutei, Channels Television News.
One of the many defining moments there of 2021. Well, Nigerians were in a hurry to see the end of 2020. Why? It was characterized by lockdowns and sit-at-home orders owing to the COVID-19 pandemic. But then 2021 brought another buzzword: vaccinations, new variants as well. And there's so much disappointment of many seeing that the variants have not yet come to an end. But let's look at the vaccination drive, how it began, starting with the executive example that was laid by the president taking his jab, as well as the vice president.
Emirates Boeing 777 conveying the Oxford AstraZeneca vaccines arrived the Nnamdi Azikiwe International Airport, Abuja, just before noon. Airport officials coordinate landing apparatus to ensure the evacuation of the almost 4 million vaccines from the COVAX facility. The consignment is handed over to the Secretary to the Government of the Federation, Mr. Boss Mustafa, who is accompanied by several members of the Presidential Task Force on COVID-19, as well as country representatives of various countries. He assures Nigerians that the vaccines are safe.
They are very effective and efficacious, and that I would urge at the time of vaccination and deployment, if you fall into the category that will be vaccinated, make yourself available. It will do you no harm. Nobody is intending to kill anybody. This is for the good and well-being of Nigeria.
In the coming months, more vaccines from the COVAX facility are expected in the country.
We're also expecting vaccines from the African Union through the AVAT platform. We're expecting some 41 million doses of vaccines from the African Union, made up of up to 22.9 million doses of AstraZeneca and about 18.4 million doses of the Johnson & Johnson.
Approximately 3.924 million doses from the Serum Institute of India is the largest single consignment to be shipped out of India, who was promising to bring another 100,000 vaccines to Nigeria.
I would also like to say that as a gesture of goodwill, in addition to these supplies through COVAX, India will also be donating 100,000 doses of vaccines for Nigeria, for which we got the approval yesterday, and it will be coming shortly as well.
The consignment is shipped expressly to the National Cold Chain Facility for storage, while the National Agency for Food and Drug Administration and Control commences analysis ahead of the vaccination exercise this week.
This is one crucial step towards halting the COVID-19 pandemic in the country. We're still a long way off from achieving herd immunity. This would only guarantee ultimately 20% of the population being vaccinated. But what critically resonates at the moment is a further adherence to the non-pharmaceutical interventions so that Nigerians can remain safe in this period. From the cargo terminal of the Nnamdi Azikiwe International Airport, Gloria Umezuke, Channels Television News.
And of course, after the arrival of those vaccines, the president and the vice president have taken their own jabs, and we've seen a lot of people rush to vaccination centers to get their vaccines. But of course, the health conversation goes just beyond COVID-19, but looking at our health infrastructure as well. And for that, joining us from our Abuja studio is the Director General of the Nigeria Center for Disease Control, Dr. Ifedayo Adetifa. Thanks for joining us on the program.
Thank you.
All right, and we also have joining us via Zoom a senior lecturer of the College of Medicine, Dr. Alero Roberts. Thanks a lot, Dr. Alero Roberts, for joining us on the show.
Thank you very much for having me.
Dr. Ifedayo, let me start with you, Dr. Adetifa, I beg your pardon. No sooner had you come in that the Omicron variant now became an issue, and it's gone on from there. Just tell us what it's been like being at the helm of affairs. We know you took over, and what you're doing differently now.
Well, yeah, it has been baptism by fire, sort of. Unfortunately, this is the reality we live in. Infectious diseases and outbreaks do not wait for you to be fully oriented in office before they emerge. And what I've had to do is to well, settle down and respond or coordinate response to outbreaks, including that of the Omicron variant that started in about November. You know, the question about doing something different, really, there is not a lot different to do because the disease itself hasn't changed. We have a different, you know, progeny or variant of concern, but the tried and tested principles still apply. Face mask would work whether you've got a new variant or not. So will physical distancing, so will avoiding crowding, ensuring ventilation. And despite the initial concerns regarding vaccination and the impacts it would have on this particular variant, vaccination still works, at least for the outcomes that are of the most interest, which is hospitalization and death. So we continue to do what we can in terms of surveillance and in terms of especially making testing available. What has been ramped up since I arrived is making available rapid diagnostic tests to complement the PCR test, all in a bid to ensure that there is more access to testing and we can identify as many of COVID cases as possible.
Dr. Adetifa, yeah, one of the reasons I asked what is being done differently is because people appear to have lost their fear. I know initially when COVID came out, you'd find people with their face masks and there was so much palpable fear. But at the moment, even with the threat of something called Omicron, even though the WHO is yet to announce that, people still say, well, what do I do? So that's why I'm asking, moving into the new year, whether there should be a different set of protocols. What do you think?
Oh, well, we have put in a few things just to sort of draw back attention to COVID and especially in the Yuletide period and help people to protect themselves and their loved ones. And so we started off by starting a campaign to celebrate the Yuletide, Christmas and New Year responsibly. And what that meant, or what that means essentially, is to remind people that uncontrolled, unmitigated transmission of COVID will lead to the emergence of new variants, as we're witnessing. And what can happen is, because you have no control over what type of variant emerges, is that you can get a variant that is as transmissible as Omicron, or you can get a variant that is even more deadly, that will result in a lot of hospitalizations and deaths. And as part of celebrating responsibly, to ensure that people protect themselves, protect their families and friends, we're also working with colleagues in the MPHCDA. have used every opportunity that we have had to also encourage people to make use of every opportunity that is afforded them to get vaccinated, because most Nigerians are unvaccinated. Vaccination affords protection if you can get your full dose. If you've been previously fully vaccinated and received your second dose more than six months or more ago, then you are likely to benefit from booster doses, because it's been shown that the boosters sort of regain the benefits vaccines have against the Omicron if you've received your full dose more than 6 months ago.
Let me come to you, Dr. Roberts, and take it from where Dr. Adetifa just stopped. Going into 2022, there are quite a lot of people who, as he pointed out, have not been vaccinated at all. And those who have been vaccinated, who thought that being vaccinated provided some sort of advantage, now get to hear about booster shots. And one of them pointed out that that means that for as long as this COVID-19 is around, we're going to keep having to get vaccinated. Is that a medical fact?
That looks like it is a medical fact. Ladi, very nice to see you. Compliments of the season. Happy New Year. Dr. Adetifa, very nice to see you too after such a long time. Welcome to the hot seat. This is actually going to be a medical fact. There's nothing we can do about it. This is a new virus. Let's go back to the beginning. Let's go back to the ABCs of the science of this thing. This is a new virus the human body has never encountered. So whether we like it or not, it is going to take us a while, a couple of years probably, to build up all the immunity. But the same way we still get colds and catarrh, the same way we still suffer flu, it looks as if COVID is going to be with us for a very long time. However, this is what the important thing is. What the science has shown us is that the vaccination mitigates against severe disease and hospitalization. And that is really where we want to get to. Because after the devastating news, many families, and a single death is a disaster, many families encountered when loved ones got really, really sick and died. That is what we are trying to avoid. So we want a situation where everybody has access to the vaccine. Dr. Adetifa, over to you. You know I'm going to be at your back, and I'm going to be calling your name. You and your friends in MPHCDA. Whatever you have to do. We don't need 4 million vaccines. We need 200 million vaccines every 6 months. Make it available, and then leave us to make sure people get it. Because what we do not want is loved ones getting sick and then families falling all over themselves, trying to find the money, looking for oxygen, looking for bed, looking for doctors and nurses to care for their loved ones. This is a medical fact, and it's something we're going to have to live with going forward.
Let me take it. Let me then ask Dr. Adetifa and move away from COVID for a second. Because the other thing that also appears to have happened in the course of 2021 is that the ball might have been dropped on some other diseases, which some have pointed out have in fact led to more fatalities amongst Nigerians than COVID-19 in fact has had, the likes of Lassa fever and cholera, just to take 2 examples. Would this be a fair comment?
No, it'll be unfair. It's incorrect. The NCDC, even since I arrived, has responded to what became a generalized cholera outbreak. At different times, we were in anything from 10 to 13 states helping the response to cholera. So I'm not, one of the first things I said when I think first appeared on TV, which is channels, is to remind people that the NCDC is not a COVID agency, that actually we have a mandate to look after all diseases of public health importance that includes endemic, emerging, or epidemic or pandemic conditions, and cholera happened to be one of them. Certainly this year's outbreak seemed a bit more severe and prolonged than in previous years, but we were with the states matching them with in terms of effort and in terms of incidence for every time cholera case was reported. So I do not think, I think that the news reports were mostly focused on COVID, and as I indicated in other places, I really would have liked to see a lot more being said about cholera, which now that it's mostly on its way out, it's in terms of deaths caused, is matched the number of deaths, at least direct deaths due to COVID. Okay, we have not dropped the ball on Lassa fever. Lassa fever, cerebrospinal meningitis are diseases that we look out for in the dry season, typically from November to May. We already had issued out advisories. We'd started off EOC's Emergency Ops Center operations for Lassa fever, just in preparation for the uptick in cases that we expected this time of the year. And we are looking at Lassa fever at the moment, and I would just like to use the opportunity again to say that, especially in the high burden states for healthcare workers, is we need to be careful. We need to remember that not every fever, body ache, and all the symptoms that people typically report for either malaria or that they are sure is what they have for particular conditions actually mean that they have these conditions. At the moment, you could have an overlap in symptoms between COVID and Lassa fever. So it's important that we all exercise as much care as we can and protect ourselves even while we look after patients presenting to the hospitals. And also for fellow citizens, I think some of the deaths we have seen reported, or cases reported of Lassa fever, have a common theme that they are reporting late. So please report to the health center as soon as possible if you have any of the symptoms, fever, generalized body pain, excessive tiredness, fatigue, and the like.
Okay, Dr. Defa, let me quickly introduce the National Coordinator of the Global Environment Facility Small Grants Program of the UNDP over there in our studio in Abuja as well, Ibironke Olubamishe. Thanks a lot for joining the conversation there. I know you've been waiting, and I know Ladi was saying that we perhaps should stay away from COVID because that's where the conversation has been. But it's going to be difficult because much of the work that's been done on climate action, even if you look at COP26, revolved around what sort of aid small and vulnerable states can be given to respond to COVID. I don't know whether that's kind of overshadowed some of the work you do. You tell us.
Thank you very much for having me here this night, and Merry Christmas, and wishing everyone a prosperous 2022.
You too.
Well, definitely. I mean, there's nothing really that is of global concern or that will not also affect what we do in terms of environment and livelihood enhancement in the communities. And what we have seen, of course, in the course of our work since the COVID issue started is a drastic, a change in the way people even accept or even respond to whatever we are trying to give to them, take to them in the communities, and even as far as environment is concerned. And one of the things that the communities at first complained about when the issue of COVID came was because we had to carry out a kind of a survey to know how COVID is affecting the work, both with the NGOs that we're working with and the communities who are the beneficiaries. And the challenge is the issue, one particular one is the issue of water, because many of the communities don't have access to water. I remember a particular project site in Benue State that they have to go overnight to go and fetch water. Before when they get to the other communities where they will fetch water, they have to stay there and wait until the communities are okay before they fetch their own and go back. And then you are now telling them that's water that you are actually managing to drink and to meet your basic work. That water now has to be used to wash your hands for at least 20 seconds or so before you can eat because of COVID-19. And we can see that, very, very important challenge as far as the communities are concerned. And so it was a bit difficult for us to convince them. But of course, when they hear the news of what is happening in the cities and how people are dying and whatever is happening, then, of course, the next question to them is, okay, what do we do? How do you help us? So we try as much as possible to find little ways, small ways, to be able to ensure that these people have access to water as much as possible, and then also to try to change their paradigm shift. Because
let me interject at that point.
Okay.
We've got to take a break at this juncture. When we come back, I'll allow you finish that and then ask you about the whole issue of how far we had gone in 2021 with climate change itself and what you expect will happen in 2022, but that's after this time. Welcome back, and thanks for staying tuned. We're on our 2021 review, and just before that break, we're talking about climate change and how it relates to issues of health and where we were with that. So I'm going to go back to our guest in the Abuja studios who was talking about that as promised, and now ask you about climate change itself. Ijoma made a reference to Pt.2, which was this really huge event that took place during the course of this year, and anybody was there. And there were quite a number of people who were surprised that Nigeria was making an appearance, because it doesn't seem as if climate change is anywhere on our agenda. Did that change in 2021, and where are we looking towards going in 2022?
Thank you very much for the question. And yes, I would say yes, because it's not possible, again, for any country to sit on the fence as far as climate change is concerned. It's a global issue. It affects everybody in the city, in the villages, in the communities. So it is not... we're not looking at business as usual again. And so from the government perspective, I remember before the COP26, the climate change policy was actually launched some months before the COP26, which was a good step in the right direction as far as the government of Nigeria is concerned. And then I also want to say that when the COP26 finished, and then we came, at the end of it, the federal government, through the Federal Ministry of Environment and the Climate Change Unit, also organized a stakeholder consultative meeting, which I was also privileged to be part of it. And then the idea was for the experts and the people that are concerned to come together and review what went wrong. I mean, what we did well, what we did we didn't do very well. How do we go from here, and what we do as far as Nigeria is concerned? And so I want to believe that, the people that are there now, honestly, I'm not trying to flatter them, but they are taking steps in the right direction, and I hope that the federal government will continue to support the efforts of these experts who are working in the area of the environment, especially the climate change unit in the Federal Ministry of Environment. So Nigeria is making efforts. If that effort is enough or it is not, is another question. But we're making effort, they are making effort, and we hope that the federal government will also put resources into whatever, because if Mr. President made a very huge and ambitious promise at the COP26, that Nigeria is going to become a net zero by 2030, and that is a huge and ambitious one. And we hope that, well, as far as Nigeria is concerned, honestly, if we have the right mindset, the political will, we can make so much progress. That's what I want to say.
Dr. Roberts, let me bring this back to you, Dr. Alero. You're joining us there via Zoom. Just taking it off from what the last guest has said about making efforts and mindset, and I'm bringing that back to medical research. Reason, because it's 2 years into the pandemic, and we keep hearing there are efforts, being made to get some indigenous cure, like an African vaccine for an African, shall I say, variant. Where are we with that? We do hear that people come up and make bold claims, but nothing seems to have come out of it. I don't know.
Well, unfortunately, research, science, the process is pedantic. The process is there. It is just has to happen. So I know a lot of progress is being made in the development, and it's not an African vaccine. It is a vaccine that we can produce and distribute in Nigeria and in Africa. And a lot of work is going on. But like I keep reminding everybody, it's one thing to make the vaccine, but the production and distribution is out of the health sector. And that's the part where government needs to step up to the plate and be proactive. If you will recall, and I think we had this discussion, Ijoma, when AstraZeneca, the Oxford AstraZeneca was being developed in Oxford, or wherever it was being developed, if you will recall, they were also at the same time making arrangements with places that would produce the vaccine in massive amounts, doses, so to speak. So that at the time when they were ready with the vaccine, they would have literally factories and manufacturing plants set up to roll this thing out. That is where we need to be paying attention, because right now, the science of producing the vaccine, to put it very simply, is pretty much a plug and play. All that technology, the knowledge is there, the technology is there. It is our Nigerian scientists in the diaspora who are also working hand in hand with our Nigerian scientists in place. But that's not where the problem is. The problem is going to be having manufacturing plants that can produce the vaccine in sufficient doses to satisfy our population. So that is where we need to be finding out what is the government doing about this. Health sector doesn't set up manufacturing plants.
Dr. Adetifa, I want to come to you and not fall into the trap that you accused quite a number of people of falling into, which is in terms of the news cycle being mostly about COVID. And so I want to ask this. In 2021, there were quite a number of work stoppages in the health sector, doctors and so on, which undoubtedly had impact on how much was could have been done in 2021. Now, looking into 2022, which is just over 3 hours away now, would you think that enough has happened in 2021 to make that experience something that will not happen in 2022?
Well, healthcare worker strikes are really not desirable, and I hope that all of the negotiations and agreements that have come out of the different disputes that underlie the strikes in 2020, 2021 would have now been solved or have been ironed out. Remaining details have been ironed out to ensure that we do not have any or do not have as frequent healthcare worker disputes or strikes in 2022 as we did in 2021.
Well, your answer sounded a bit diplomatic, but I raise it because, and I raise that because, of course, you're in a position of authority. But let me then ask the same question of Dr. Roberts,
because we can hear her laughing.
Yes, and she is one of those workers. Is there enough on the plate, do you think, for us to achieve sufficiency in vaccine distribution and getting people immunized and having them guard against all these other diseases we've spoken about in 2022 in terms of ensuring that there are limited, if not no, work stoppages?
Laddie, you are troublesome. That's my problem. You like to ask the difficult questions. It's good. It's very good because you know me, I'm going to say it as it is. The truth of the matter is, we heard about what, a week ago, 805 new Nigerian doctors have joined the UK workforce. And I mean, I'm talking to a lot of my friends in the UK workforce who are Nigerians. There's a certain town where a certain child I know lives, that 2 years ago, there were 2 of 5 black faces in that town. Now, there's a whole class from OAUTH. There's a whole class, R5, who have now relocated to that town. How do you want to build a health sector without doctors, without nurses, physiotherapists, pharmacists, medical lab scientists? How do you want to do it? How will there not be work stoppages? How will there not be dissatisfaction in the health sector? While we are paying attention to so many, I mean, we're not paying attention to the things that need to be paid attention to in the health sector. Right now, the health sector needs to be the blind of the administration. And they need to do everything they can do to make sure the health sector is happy. From cleaner to clinician, the entire health sector needs to be pampered like a bride to make sure that we can deal with some of these things. Because the next thing that's going to happen, 2022 will come, people will be dissatisfied. There are already rumblings in a certain union that shall not be named. Because if anything happens and you attend to only the doctors, other unions are going to say, are we not part of the health sector? So no, I don't think enough has been done. That's the bottom line. Okay. I simply do not think enough has been done to make sure that the gaps that COVID has shown in the health sector are being addressed.
Okay, Dr. Roberts, I'm going to come to you now, Ms. Olubamise, for your closing moments there. Let me put it like that. I know Dr. Roberts is passionate about the health sector, asking it to be pampered like a bride. You're passionate about environment. What would be your last statement, let me put it that way, as we round up?
And could you do that in 60 seconds?
Okay, thank you.
Try and do that in 60 seconds.
Thank you, Ijema. And well, what I would say is that I tell everybody that cares to listen. Gone were the days when somebody would say, give me a proof that the environment is changing. Give me a proof that this is happening and that we have to do something about the environment. And I tell people today, you don't have to go to the lab again to be able to prove that the environment is changing, to be able to prove that the climate is changing. And we have to do something about it. What everybody, every other sector, every other area in the world depends on is the natural resources, be it industry, health, anywhere, businesses. Everybody depends on the environment in one way or the other. And we have found out that business as usual will not take us to where we ought to be or get us what we need to get. And so everybody, whether educated or not, needs to have a paradigm shift that we have to do something to protect the environment. Yeah. We have to do something to protect the nature, the natural resources that we have. And then the climate is changing. Everybody now knows that weather pattern is changing and all that. And so people need to know what to do from the individual level to group, to companies, to the government, and the global world, which is part of what the COP26 is all about. So
all right, we're going to have to
say. Everybody needs to get involved.
We're going to have to thank you so much for your insight there. National Coordinator, Global Environment Facility Small Grants Program of the UNDP in our Abuja studio, Ibirunke Olubamise. And also to thank the DG of the Nigeria Center for Disease Control, Dr. Ifedayo Adetifa. Thank you so much for the insights and welcome to the hot seat, as your colleagues have mentioned. And also Senior Lecturer, College of Medicine, Dr. Alero Roberts. Thank you so much, Dr. Roberts, for joining us on the program.
And compliments of the season and a Happy New Year.